This is a patient who has massive macular edema, vitreous traction, and will see a fair amount of ischemia secondary to a central retinal vein occlusion. We've done an anti-VEGF injection, which really didn't budge the edema all that much. In these patients, we found that we really have to hit them hard and aggressively, typically with both anti-VEGF steroids and vitrectomy surgery to release the traction. And here we're going to see the power of ingenuity with different digital color filters. As we can see, everything looks kind of like a sea of red. But when we go to the blood suppression filter, we can see that we're able to visualize better through the vitreous hemorrhage. But one thing that we've noted is the posterior hyaloid is actually enhanced while the vitreous blood is suppressed. So you can really see a little bit of a sheen better against this background, I think, than this kind of orange tomatoey background with the standard color filters. And with the bevel 10K cutter, you can really get a precise plane, and we're going to see that here, and we're going to slowly peel away the posterior hyaloid. Now, one thing that we've been interested in is actually trying to quantify if we can see better through vitreous blood. And if we export images of the retina where we're looking through the vitreous blood, either with the standard filter or the blood suppression filter, we take each of these images, which are almost simultaneously exported, and if we convert the signal to grayscale and then put a line to measure contrast across the vessel, there is indeed more contrast going through retinal anatomic landmarks such as vessels or laser scars in the blood suppression filter compared to the standard digital filter. And here we're able to see the posterior hyaloid comes up nicely, so although we're suppressing vitreous blood and improving the contrast to the visualization of the underlying retina, we can actually see the posterior hyaloid quite nicely, and we can see membranes quite nicely. Now, one unexpected twist here is when we went to this digital color filter, you can see that along the superior temporal arcade and inferiorly and temporally, there is a color shift in the retina. They're pale retina along the superior arcade versus the darker retina peripheral to that. And we surmised that this darker retina was likely more ischemic by its appearance and where it was located in the retina. If we went back to the wide field fluorescein angiogram, indeed that was the case. We're really not sure how this occurs, but this filter actually allowed us to see ischemic retina, which allowed us to tailor our laser. Here we're peeling internal limiting membrane, and we can see that it's a difficult peel because the retina is so swollen, but with the high resolution and enhanced stereopsis of Ingenuity, we can really see better to do the peel. So we know Ingenuity has better stereopsis, better depth of field. We're showing that it has better contrast through vitreous hemorrhage by showing the digital filters. And in this particular patient, the digital filters actually allowed us to visualize ischemic retina in vivo, which I really found quite fascinating. Thank you.